Good afternoon, everyone, and thank you for being here. Let me get that for you, Doctor. Yes. So this is our last press conference at the Vets, and so I want to just thank everyone who's been listening in daily or weekly as the covering this important time frame over the last year plus. So we couldn't have done it without the people who live in the state of Rhode Island. And as many of you know, the press conference was originally scheduled, this one for May 27th, but with the CDC mask guidance and joint decision to move fully reopening for Friday the 21st, we want to make sure everyone had all the information that they needed. And so I want to thank the media here as well to inform people about what is going on. So thank you for your flexibility. So I'm joined here today again by Dr. Alexander Scott and Tom McCarthy, as well as Stephen Pryor, along with Matt Weldon from the DLT. So we have some good news. During the pandemic, we know that we received, at least I know our office did, several 100,000 masks from outside the country during that time frame when we were struggling on our PPE, and then in our office we were able to distribute that to many businesses in the state. Well, we're returning in kind, right? So right now it's good news that we're in partnership with Care New England with an approval from the federal government, and Rhode Island was able to send 200,000 COVID tests to support the global relief efforts in India. So thank you for everybody in Rhode Island that is returning the, returning the kindness that we've received from different parts of the world, and this year is being sent to India. So I think tomorrow is the tomorrow that many people across our state have been waiting for since the pandemic began. Tomorrow, Rhode Island, with a few exceptions, will be reopened. The plexiglass is coming down, and most establishments will be at full capacity. Casinos will be open as we knew them. Restaurants will be bustling. Nightclubs will start to be meeting places once again. So I want to go through some of the reopening guidelines, and then we'll certainly be open to questions about any particular issues that maybe want to be asked. But it's about the fact that we've reached that 1 million shots and continue to vaccinate all age groups, including the 12 to 15-year-old, that we're comfortable taking these steps. And just now, we have 70.1% of Rhode Islanders 18 and over with at least one vaccine shot. That's 70% with one vaccine shot. And we know that that translates into fully vaccinated within 2 weeks of today at the very latest, 2 to 3 weeks, depending on what shot everybody received. So the guidelines that we're reopening on Friday, it's safe for people who are fully vaccinated, and we want to keep on emphasizing that. The vaccinations are what allow us to reopen, and those who are not vaccinated, we're not done in our efforts to get everyone who is eligible in the state of Rhode Island to be vaccinated. So fully reopening gives businesses and organizations, individuals the option to loosen their restrictions right away. Some may take a bit more time, and as I said on Tuesday, let's have courtesy and understand that just as it was getting used to wearing the masks over the last years, and certainly people were more comfortable sooner than others, it's going to be the same thing in reverse. It doesn't matter whether we did it today, 3 weeks from now, 4 weeks from now. There's going to be that it's going to be a transition, and so let's respect people during that transition. But also, it's another message that people who are not vaccinated. We want you to wear a mask inside, and we want you to seek out the ability to get vaccinated. That, again, is what is allowing us to reopening our economy and it also will allow us to reopen our schools. So this week, lifting the restrictions is going to mean more and more people out and about and more people moving through different social groups. The best way to stay safe, get vaccinated. Some of our mass vaccination sites are going to start winding down, and local clinics and pharmacy locations are meant to meet the people where they are. And Tom, I'm sure we'll get into how we're going to actually do that in a very proactive way, and we're going to continue doing that. You know, as long as there's anyone out there that needs to be vaccinated and is eligible to be vaccinated. I visited an amazing, well-run clinic with our Lieutenant Governor this weekend at Ponagansett Middle School, and another small business on Broad Street. So again, the signal to the people who are watching is that if you have groups of people, regardless of whether it's 1, 2, 10, 5, 10, 20, 100, let us know. 100 shots. We're ready, and we're mobile. We're very mobile. So we have upcoming partnerships, for an example, with local mosques, the Newport Gulls baseball team. I think I get to throw out the first pitch with them, as well as Duncan. Continue working with our business community and our church groups and our civic organizations to make sure that we continue to vaccinate people. So if you're wondering whether you need an appointment for mass vaccination sites at the Dunkin' Donuts Center or Sacanasset, you can get vaccinated on your lunch break. You can do a walk-up. With an appointment and a 15-minute observation time, the whole process should take about 25 minutes. That's just 25 minutes. Stay safe and make sure your family stays safe. Take the initiative to do it. We know that vaccination numbers in different communities are low, and we're going to continue to focus on where we might be able to improve. We know that vaccination numbers, and I've been working with Mayor Baldelli Hunt, Woonsocket, that we're going to get into the senior facilities, the high rises, because we know the numbers are they're not meeting the percentages that we have on a statewide basis. We're going to go right there with Mayor Baldelli Hunt and give the people in Woonsocket and any of our 39 cities and towns that opportunity to get vaccinated. We also know there's still work to do with Rhode Islanders under 30, parents with school children living at home, and work continues with members of our communities of color. That is going to continue, and we're going to continue to work with our leaders in all those communities, including the BIPOC community, in a very active and aggressive way, because we're not done with doing the vaccinations, even as though we reopen. Talk to somebody you know that's gotten vaccinated. Ask questions. Find out whatever you need to find out to get comfortable enough to roll up your sleeves. And again, it's repetitive, but that's really important to you and to our state and the communities that we live in. So vaccination numbers overall, things are looking very good. Hospitalizations are down, cases are trending down, vaccinations are trending up. From the last week to this week, we more than doubled the percentage of 12 to 15-year-olds that have been vaccinated. We're at 97% of our 65 to 74-year-olds vaccinated. All other age groups over 50 are coming out strong and are over 70%. We're looking to you, to the 40, the 49-year-olds, walk up to a vaccination site today. We are still in need of being careful about the aggressive COVID variants, and Dr. Alexander Scott will speak to that, but we continue to move in the right direction. Otherwise, we wouldn't be doing what we're doing tomorrow. It's safe to be out as long as you're fully vaccinated, and we encourage those who are not vaccinated to continue to seek out the vaccinations. So on the new regulations, if you're a business looking for more information, please go to reopenri.com, reopenri.com. Every time there's a transition, there's always questions, and we want to make sure you get answers to your questions. There are print signage resources, reopening guideline charts, and masking guidance that have been updated. If you are a business that has a question, you can go to the Department of Business Regulation to their website or call and leave a message on the COVID-19hotline at 401-889-5550. We encourage you to call that number if you have any questions in your reopening. We want it to be successful, and we want to make sure that the people you do business with understand what is happening. 401-889-5550. So can you please put up the reopening slide on the screen? It's a little detailed, but I think it's worth going over. As of Friday, May 21st, the following adaptations by sector will be effective. No physical distance is required. Indoor dining, no restrictions. Bar area, no restrictions. Indoor standing service allowed. No plexiglass required. Catered events, no restrictions. 100% capacity with no cap. Indoor and outdoor standing, bar service, cocktail hours, open dance floors. House of worship, no restrictions. Retail, no restrictions. Gym, sports, recreation, no restrictions. Personal services, no restrictions. Venues of assembly, no restrictions. Funeral homes, no restrictions. Offices, no restrictions. Social gatherings, no restrictions. Transportation, transit include ferries, buses, shuttles, rails, ride-sharing programs, no capacity restrictions. Other state and federal rules remain in effect. Pools, no restrictions. Casinos, no restrictions. Sports, mask requirements remain in place for all youth sports, indoor and outdoor. CDC has recommended this through the end of the school year because our young people are not fully vaccinated yet. We will reassess this on July 1st. Adult sports have no restrictions and will follow CDC guidance. In the following sectors that are considered higher risk, CDC mask guidance for vaccinated individuals is especially important. Live vocal performances is the status quo. You can move to no restrictions if vaccination proof is required. Nightclubs remain at 50% capacity, can move to no restrictions if vaccination proof is required. Indoor hookah, currently prohibited, can move to opening with no capacity restrictions if vaccination proof is required. Three sectors remaining on the status quo. There are three key sectors that are remaining status quo. Healthcare settings, congregate care settings, youth and school-based events. And Dr. Alexander Scott will be going to a little bit more detail on those issues. Conclusion. Thank you again. This is a big weekend. Please be patient and courteous with each other as we all navigate this next phase of reopening our ocean state together. People are going to have different levels of comfort, and I ask that we embrace each other's choices and move forward in reopening with that sense of unity and community in mind. Could you please pull up a slide recognizing the many people here at the Vets and the Capitol TV that have made these press conferences happen. I want to thank each and every one of you. You represent thousands of people in the state of Rhode Island who have stepped forward in a significant way to make this event happen daily, initially, weekly, and now concluding today. And I believe there's going to be an event here very shortly, and I think September is going to be the first full-time event at the Vets. And I know that they're excited about getting people back in and enjoying the entertainment and the arts that this facility is so well known for. So conversations around the state are just starting on how we can work towards, as we imagine, 2030. Please join us for a virtual community conversation at 5:30 on Facebook. The topic tonight will be on the importance of higher education and what that will look like and by 2030 and what we're going to do between now and then. So let's stay positive, let's test negative, and vaccinate the Ocean State. Now I'll turn it over to Dr. Alexander Scott. Doctor?
Thank you, Governor. Good afternoon, everyone. So much of this pandemic has been about what you can't do. And what we're discussing today is an important moment. We've been slowly planting the seeds with you about making that shift from those important restrictions that we had in place to keep everyone protected to you all now having the tools you need to be personally responsible for yourself and your loved ones in keeping you protected and allowing us to reopen the economy safely in doing so. So we're finally talking about what you can do if you are fully vaccinated. It's important to understand what fully vaccinated means. Fully vaccinated means that you have received all of the doses of the vaccine that's required for you to be protected, and at least 2 weeks have followed since your last dose. That ensures the full protection that's in place. So I want to talk a little bit about how we arrived here so quickly. The Centers for Disease Control and Prevention have been able to relay some of the very quickly evolving science that led to the confidence that they shared in terms of the shift with our masking. A key for us in Rhode Island is to first take into account what's happening with our data. Our percent positivity has remained below 2% for 10 days. And remember, the lower, the better. Our percent positivity that we're reporting today, of yesterday, is 0.7%. When is the last time that you recall Rhode Island as a state having a percent positivity less than 1? That is tremendous. Similarly, our new hospital admissions and fatality numbers have also decreased dramatically. It's key for us to know that our tools to bring us over the finish line have been working. We've spoken about testing. We want you to keep having access to it as you need it, treatment when it's indicated, and vaccinations. It works. It has been working. We're seeing that in our numbers locally. That gives us the confidence. The other reason is to be able to share with you some of the updates in the data and science that we always base our decision on that have come through. The overall thinking with the data and science is based on a number of national and international studies that have continued to update for us the new information that we're learning about vaccines and its effectiveness. A way that I have thought about it is the vaccines are proving to be so effective that even if you are in a crowded area, indoors, amongst people who are unvaccinated or positive, once you are fully vaccinated, you can rest assured that you have the protection needed to keep you and your loved ones safe. That's a game changer. The first big national and international study update that has been shared is that the vaccines we have are working in the real world scenario. We had high hopes because we knew what the clinical trials data told us. And we've now seen, with hundreds and millions of vaccines, thousands and millions of vaccines given nationally, that clinical trial data has lived up to expectations and has performed exceptionally in real world settings. Studies from real world settings around the world, literally, numerous countries, show our vaccines to be more than 90% effective in preventing mild and severe disease, in preventing hospitalizations, and in preventing deaths. And as you've heard us say from the beginning, particularly when we were rolling the vaccine campaign out in phase 1, our primary responsibility was to keep people out of the hospital and keep people alive with our vaccination approach. What we've seen even here in Rhode Island is that the breakthrough cases, people who have been fully vaccinated and end up getting infected, is so extremely low, it is less than 1%. It's actually 0.15%. So that means 99.9% of the time, almost, the vaccine works tremendously effectively. That far surpasses what we saw with the clinical trials, and it's amazing when you compare it to what our vaccines usually do. From a public health standpoint, a vaccination tool is powerful. When it works 99.9% of the time, that is amazingly powerful. Our second major update is that the vaccines have proven to be effective against the SARS-CoV-2 variants that are currently circulating both in Rhode Island and in the country. It's important to know that the variants are the predominant form of coronavirus here in Rhode Island. So as I said last week, you cannot rely on natural immunity to be protected. If you've been infected in the past, you likely did not have a variant form. You had one of the older forms of coronavirus. Very quickly over the last few weeks, the predominant form are our variants. So do not just rely on natural immunity or herd immunity to be protected. You as an individual and your loved ones have to be fully vaccinated in order to have the protection. And what we've seen now, it took a while for researchers to be able to say this with such certainty, but we have that confidence now that the vaccines work particularly effectively against the variants. CDC highlighted 2 studies in particular that show that the vaccines work well against the B.1.1.7 and the B.1.5.2.6 variants. Both of those are among the most common variants here in Rhode Island now. That's also tremendous. The third significant update that we have from a data and science standpoint is the research that's showing if you are fully vaccinated, you're a lot less likely to be infected with the virus at all, regardless of your exposures, and therefore you're also less likely to spread the virus to anyone. That's an important science update for us, because if you recall, when we first started vaccinating people, we were very transparent with you about what we knew and what we did not know. We knew that the vaccine would prevent most people from experiencing severe illness and keeping you out of the hospital and keeping you alive. We've been saying from the beginning that it's extremely effective at doing that. We were not as sure about how effective it was at stopping the spread of coronavirus, particularly if you were a person who had asymptomatic infection and unknowingly transmitted it to other people. We now have evidence that suggests that fully vaccinated people are much less likely to have asymptomatic infection, be infected and not know it because they don't have symptoms, and then much less likely to unknowingly spread coronavirus to other people. In addition to, of course, continuing to prevent severe illness, keeping people out of the hospital, and keeping people alive. People who have a condition or who take medication that weakens their immune system will want to talk to their healthcare provider about what is right for them when it comes to mask wearing. We know that these individuals, for sure, we want to be fully vaccinated, but we want them also to have that extra support from their providers about making these very individual decisions. But it's important to know that if you are fully vaccinated, we are saying, based on the science that the CDC has brought to light and has shared, that the vaccine works effectively to protect you and your loved ones. Even if you are in a crowded setting, the understanding is you are protected. Even if you are around people who are COVID positive, once you are fully vaccinated, you are protected. The key here is to get the message to those individuals who are not fully vaccinated, or if you're thinking about it. We are shifting to this personal responsibility and giving you the tools that are needed. The economy is opening back up. If you're fully vaccinated, it's safe to go out. It's safe to really enjoy and have a great summer in Rhode Island. If you're not fully vaccinated, now is the time to get vaccinated because it's not as safe for you. And coronavirus and the variants that are out there are looking for those who are more susceptible because they are not protected and not vaccinated. And so now we can say being fully vaccinated makes a difference. It allows you to feel more comfortable not wearing a mask in these settings and not requiring it, or not social distancing in certain settings. And if you don't have the protection of a vaccine, please encourage your loved ones, your coworkers, people that you worship with, people that you learn with, anyone that you know, encourage them to go get vaccinated so we can all enjoy together. It's important to know if you are not fully vaccinated, you've only received one dose or no doses at all, you need to wear your masks indoors, in public settings, and outdoors when you can't keep a distance of at least 3 feet from other people around you. So I mentioned that fully vaccinated people don't have to wear a mask, and that's in most settings now. It's important for you to know what we're saying here in Rhode Island, because there are still some places where masks will be required, even for people who are fully vaccinated. Let me go through those places quickly so we all have a sense together. Please show the graphic that we've made. The places where you would still need to wear a mask, even if you're fully vaccinated, and certainly if you're not fully vaccinated, include schools and childcare settings, healthcare settings like hospitals, doctors' offices, and nursing homes. And if you are a home health worker and you're in someone's home, that's at that moment considered a healthcare setting, which means you need to wear a mask there too. Public transportation like planes, RIPTA buses, and trains will continue to require mask wearing. Transportation hubs like airports will continue to require mask wearing. Places that serve people experiencing homelessness will be important to continue require mask wearing, as well as prisons and correctional facilities. Other places where masks will be required include cities and states outside Rhode Island, where they are continuing to require mask wearing, and in businesses in Rhode Island that require it. Our key here is to support businesses, encouraging the reopening of economies, our economy, and people feeling confident to go back out. Businesses can put in place more strict health and safety requirements if they choose. We want to support businesses in doing what they need and help make it known to the public. These are businesses that are following the safe practices and activating the tools that we've provided to be able to cater to you effectively. We're developing signage for business owners to help them communicate to guests about how they are implementing their safe practices, including masking policies. Some places may want to keep masking policies in place. As we move into this new phase, where some places will have masking requirements and others won't, I want to ask you to remember two things. Number one, don't just ditch your mask. Keep it nearby. If you're in the habit of grabbing your mask on your way out the door, keep doing that. Keep one in your bag, one in the car, one in your pocket. You don't know if a mask will be required in the place where you're headed to, or if you're in a place where you will just feel more comfortable putting a mask on. Keep it nearby. Don't just ditch your mask. The second major thing is if you're in a store or other important business and you get asked to put on a mask, be patient, be tolerant, and be respectful. There is a reason why that business owner has that policy in place. Some people may have special circumstances. There may be individuals who work there who are immunocompromised with something like cancer, and we want to make sure that anyone who comes in the door has that additional layer of protection. Let's support each other as we are reopening our economy and branching out to enjoy Rhode Island this summer. It's going to be an adjustment for us all. This is an adjustment that is an important one. It's one that we've waited a long time to be able to do. What's key for us is to do it well. We want to stay focused on our public health outcomes, keep our numbers strong the way we have been, and make sure that everyone has access to getting fully vaccinated. You know, and you're going to hear more from Tom, how hard we've worked to operationally ensure that access to getting vaccinated is available to everyone in every zip code possible. If you're someone who might not be ready yet to go grocery shopping or to sit in your cubicle at work without a mask, even if you are fully vaccinated, that's totally fine. I'm keeping mine with me, and sometimes I may prefer to put it on. That person should feel totally empowered to keep wearing their masks if they choose to. And everyone around that person should make sure to respect that decision as well. Rhode Islanders, you all have done an amazing job supporting each other over the last year and a half. And I know that we're going to keep that up together and achieve our goal of enjoying a wonderful summer here in Rhode Island together. So with that, I'll invite Tom McCarthy up to the mic. Thank you.
Hey, good afternoon, everyone. So on top of the great stats that the governor and Dr. Alexander Scott shared, we had a busy week last week. So we administered more than 74,000 doses, which is close to the 80,000 dose peak that we'd seen throughout the height of the vaccination campaign. So people continue to return at an extremely high rate for their second dose, and we continue to administer first doses across all of our age bands in Rhode Island. We're extremely proud of the progress we've made, and I can't say enough a huge thank you to all the people that make this happen every single day. We've made getting vaccinated in Rhode Island accessible, easy, and fast. As the governor shared, for people who make appointments at our mass vaccination sites, you're in and out in 25 minutes, and that includes that 15-minute observation period. Bring a friend, and we'll vaccinate them too. Even if you don't have an appointment, it might be a little bit longer, but you're still in and out quickly. Another thing I want to talk about today is vaccination records. So we recognize as we kind of shift to this next phase of reopening that people may want to carry their documentation for proof of vaccination on them. The best proof that you have is the vaccination card that you receive when you receive that final dose. Make a copy of it, take a picture of it on your phone, keep it in a safe place, get it laminated. If you've misplaced your card and you want proof of your vaccination status, Right now, you can go to portal.ri.gov/vaccine record. And on that site, you can look up your record and you can print it. If you run into any issues, you can always call 401-222-8022. We're putting the finishing touches on a system that will allow people to call in, and we can then mail you a paper copy of your vaccine record. So we'll have more to come on that here shortly within the next couple of weeks. The last topic I want to talk today relates to our vaccination infrastructure and our mass vaccination sites. And we've spoken a lot over the last few weeks about phase 3 of our vaccination campaign and what that means. And this is all about being responsive and light and nimble, meeting Rhode Islanders where they are and putting vaccines in their paths every day. So a big part of this means being less reliant on our large mass vaccination infrastructure as we push out into communities. So for that reason, what you'll start to see is that some of the larger sites are not showing up as frequently for first doses on vaccinateri.org. Similar to what we did for our alternative hospital sites, we're going to ramp down operations at some locations. They'll be ready, but we won't staff them the same way. For example, the South County site is going to begin ramping down this weekend, and the Woonsocket site next weekend. Both sites will still be equipped as needed to run clinics for specific community-based events. But the big thing to remember here is those mass vaccination sites are just a building. It's the people and the teams inside that we're pushing out to the communities that allow us to sustain that vaccination capability. So I want to reassure you that there are still many places to get vaccinated. The pharmacies, both the big chains and the independent locations that have been phenomenal partners throughout the campaign, really anchor this third phase and enable us to have that geographic coverage that we've had throughout the state. With that, we'll continue to have our regional municipal sites, our mass vaccination sites will still play a role, and the dozens and dozens of pop-up clinics that we have each week, and then continuing to push into doctors' offices and other healthcare providers. So as we start to ramp down some of these mass vaccination sites, we'll be handing out material that helps people understand where they can get vaccinated, that they can give to their friends and their family and others in the community nearby. We encourage people to continue going to c19vaccineri.org. Here, there's instructions on how to make an appointment across all of our different vaccination opportunities. And there's also a vaccine locator tool where you can search for the nearest vaccine opportunity to you based on your zip code or your address. So looking forward to continuing that strong vaccine campaign into the summer that's allowed us to reopen safely and keep us open safely. So with that, I'll turn it over for questions.
So just circling back to the topic we were talking about the other day about the Providence superintendent, did you tell the commissioner to tell him to resign?
Yeah, so I'm supporting with the call for his resignation, and hope to see that done very quickly.
What's happening now? Are they negotiating a deal? Is he going to get a golden parachute to leave?
I think there are some negotiations going on right now, and we'll see where that lands. But my understanding there is some exiting negotiations going on.
Just finally on that, what is your confidence level in the education commissioner?
I have a high, I think that the commission has done a good job, and she's going to continue to do a good job.
Hi, Governor. Your office recently told me that you weren't going to be implementing vaccine passports. However, for nightclubs to fully open and other businesses, it's required to show proof that you're fully vaccinated. Why the switch, and also why nightclubs specifically when bars also have standing service might allow dancing?
Yeah, so I mean the passports, that's an open issue. I think if it makes sense to do it in the reopening, then it makes sense in those areas. But in terms of the live performances that you're talking about, right? You're talking about live performances? Nightclubs, yeah, in terms of live performances. That is just, that's what we feel as though is the safest way to do it, and so that's why we're proposing it. Anything on that, Seven?
Yes, sir. What the governor said is completely accurate. And I'll say also that we're not requiring vaccine passports, no specific format for proof of vaccinations. Tom outlined it very well. There are multiple ways that someone can show that they are vaccinated, including the original vaccine card, including a digital image of the card, including one of these records that you get off of the website. And also, an establishment could decide that they're just asking individuals for their vaccine status. So these are options up to the local establishment, and we're not requiring a passport the way other states may be. An establishment might decide they want a specific format.
To clarify, they could simply ask the question, are you fully vaccinated? And they could fully reopen. But just because they're asking that question doesn't mean that everybody walking in is fully vaccinated.
That would be, if they were choosing that method, I'd recommend that they call the health department or commerce and talk through their strategy.
Okay,
Governor,
Governor,
I have a question from some business people. As you're aware, there's the worker shortage. They said they are considering hiring, whatever term you want to use, illegal, undocumented, but because they don't have social security numbers, they seem to be running into a problem. They want to do it official. How would you advise those businesses?
Well, I think that if they are, I'm not sure exactly how would you advise them on that? They need workers. We know they need workers. We don't want to break the law. So.
They reached out to me specifically. They said they reached out to the IRS and they said, you can't hire them. But I mean, we've talked about, and I'm not debating the whole element of licenses, but they're here. Now you have businesses that need workers, but they want to do the right thing and add them to the payroll. So how can we advise these businesses?
Well, there's undocumented that do pay taxes. They do pay into the system, and so they have provisions there. I would say that they should be, I would be pursuing a strategy where they can legally work there.
And what would that entail, though? Because again, this is like real time, trying to hire people. They don't have a social security card number to fill out the proper paperwork.
John, we can follow up DVR too if you'd like. I know there's some other COVID related.
Yeah, I would just say it's a difficult issue. I would say that they should be following the guidelines, following the law. I'm not an immigration specialist, so I certainly we can follow up with you on that, John. But acknowledging that it is a problem, and that's why we'll be signing something tomorrow that we hope will help with that situation.
Just clarify for graduations, outside graduations, should children be wearing masks for outside high school graduations next month?
Yeah, I'm not sure that the school guidance on that, if it's an outside activity and not an inside activity, I would say it's a little bit different than that, but we'll get the clarification. I'm not sure exactly what the schools are doing, but they do have the ability to kind of set their own rules on it.
Anita, Pat.
Hi, Dr. Alexander Scott. Good afternoon. I have two areas that I want to ask you about. The governor said at the outset, youth sports outside, that they would revisit that in July. Why would you continue to have kids wearing masks playing sports, particularly when Massachusetts just revised it to allow them to play maskless? What is the theory and the science and the data behind that?
The first is that many of the children who are impacted have not been able to get fully vaccinated yet. And the CDC masking guidance is focused on individuals who are fully vaccinated. The CDC has also shared masking guidance specific to sports and requiring the masking among children who are not able to maintain their distance effectively. So the science is very clearly the masking confidence in being able to remove it refers to individuals who are fully vaccinated. Many of our children are not there yet because of that mixture and inability to maintain the distance that they need. The preference from the CDC and what we are supporting is getting through the school year, continuing the mask wearing.
I got an email from someone who lives in a building run by a local housing authority. She said they are prohibiting visitors they've classified themselves as a nursing center or whatever. What would the Department of Health guidance be if you're living in a public housing by a housing authority? What would prohibit visitors in that building?
Yeah, right. That's something we would need to get more information on. Certainly with vaccination, particularly being as high as it is among our senior or other housing units, we would want to encourage visitation. So we've been working closely with the healthcare related facilities that we align with to ensure they have what's needed to allow for visitation, particularly among their fully vaccinated residents.
Anita, Pat, the gentleman in the tie.
Governor, today, this morning, you re-signed the state of emergency executive order. I'm trying to get clarity on when that, it was extended to the 10th or the 18th. Why did you decide to do that as the state continues to open fully?
Yeah, so I've mentioned that when the time comes, we'll take that emergency, that executive order off the table. We're not signing it we're signing some extensions of executive orders. We're not putting new in place. We're working with the General Assembly on that. But for the moment, we still feel as though that we're in an emergency situation. So we're gonna, even though we are reopening, and we're telling people we're reopening safely, but we're also saying we got vaccinations left to do.
Lastly, my second question, I should say, you said at your last briefing that at the end of this week, you would have plans as to when the State House will reopen to the public and when municipal government will reopen in person. What are those plans?
Yeah, so I believe that there's be some announcement about some opening of the State House on a limited basis initially. I believe those conditions are being determined now. Municipalities reopening the municipalities are going to decide when they reopen in terms of their town halls or their city halls.
The state is opening at 100% in most capacities. Why is the State House remaining at limited capacity?
Yeah, so I think that we still, there are some phase-ins still going on, and we feel as though the State House is a place to open up in a gradual way. And so that's the position that the people who are helping me make that decision are taking. So I'm following it.
Let's take a quick one.
It's been a year of that.
We can get an answer in a week or two. That might help as well. Governor, from the perspective of public policy, there is yet to be much done by the state of Rhode Island, not the state of Rhode Island acting proxy of the federal government, to act a small business community that's been devastated by government-imposed shutdowns, government-induced labor shortages, disruptions in the supply chain. Now, minimum wage increases and a carbon tax are on the horizon. What specifically is the state going to do to ease the incredible burden placed upon small businesses?
Well, I don't think anybody's stepped up for the small business more than I have in the last year. Millions of dollars have gone out in grants, and they're going to continue to go out. We're going to have an economic recovery bucket on the dollars that are coming in federally. We'll certainly have more information on that. So we're going to continue to work to make Rhode Island more and more friendly to small businesses, and there's ways that you can do that. Like I mentioned this morning, we got usury rates in terms of penalties when people can't pay their taxes on time, about 18%. We've got penalties that are around 14%. Those should be geared to some sort of a, prime plus strategy there. So there's many things that we can do if there's a will to do it. I'm certainly going to be continuing to help the small businesses in any way that I can. But the most important thing we can do is reopen the economy and do it as quickly as we can. And that's what the small business community is going to enjoy this weekend.
Consistently, both administrations, the prior and your administration, have effectively claimed a state response, which is actually federal dollars. So in a sense, all you are doing is funneling federal dollars. When will we see something specific? We've seen urgency on legislation on all sorts of social matters, yet we have yet to see any legislation seriously presented which would act, for example, maybe waiving fees or penalties.
So I visited, and we get on to the next questions, but I think it's important. So I continue to visit businesses. I visited a business yesterday, had a fire chat with them that's going to go on national level, a business in Lincoln, Rhode Island. One of the things they said to me? Our Commerce Department is the reason that we're here. So if you look at the programs that are in our Commerce Department supporting current businesses as well as, businesses that establish themselves, and that's just one piece, there's going to be a strong effort in my administration to make sure that the small businesses are treated in a way where they can earn a living, and it's going to help strengthen our communities.
Governor McKee, with all these businesses opening 100% tomorrow, a lot of them still having issues hiring workers. In your conversations with local business owners, do you see how long this issue could last and what they're doing to combat that?
Yeah, I've acknowledged this on the stage that's a top priority of ours and mine included. I had an interesting conversation with somebody yesterday that was explaining how difficult it was to get workers, and yet he let me know he's having the best year he's ever had. So I won't, let's make sure that we understand that the economy is growing. We've mentioned here that it's time for people to get back to work. We've set a date of May 23rd where they're going to have to show people who are on unemployment are going to need to show that they are looking for work. And we'll sign a bill tomorrow. I think that Matt Weldon could kind of go into detail on that if you'd like now or later. But we are working, and we're the only state in the country right now that's passed legislation that is going to provide a path for that people can continue to collect that through the $300 bonus and go back to work. So if there's more to be done for sure. And we're looking for examples of anybody that's done it better so we can copy it. But right now we're leading in that effort relative to get people back to work and still protect those three things: get people back to work safely, make sure we maximize the earnings in the families, and make sure that we get enough hours to operate our small businesses. That's an absolute priority for me right now over the next 60 days.
This is for Mr. McCarthy. On today's slide, even if you're vaccinated, you still need to wear a mask, bullet point 6. In places that serve people experiencing homelessness, that must be a tough part of this operation. Can you kind of explain how you're vaccinating the homeless?
Yeah, our approach there throughout the vaccine campaign has been, in partnering with the many organizations across the state that specifically serve that group of Rhode Islanders. So obviously the most challenging part is locating and reaching them. So they've been fantastic partners there. I don't recall off the top of my head, but I can get back to you with it. But we've administered a large number of doses to our population of Rhode Islanders experiencing homelessness. And we've continued to do that as we identify them throughout the state. So I anticipate we'll be continuing that throughout the campaign.
Governor, do you plan to bring the message to the Latino community with the Lieutenant Governor Matos? Because not every radio station in Hispanic covering this live, and we need a message to go into the Latino community. Any plans from your office to go visit the 3 other radio stations in Spanish with Sabina Matos?
I think that is a very good idea. I've been to all of them, so we certainly can come back with the Lieutenant Governor and talk about the mask policy for sure. We can get that done. We'll ask them if they invite me, I'll go.
And the last question: are you supporting Angelica Infante Green with the situation that's going on now in the state and the city of Providence? Will you help continue working here? You're going to continue supporting Angelica Infante Green, and she's going to be staying here in Rhode Island.
I support the commissioner, yes. And I do support her decision, as I've said publicly, in terms of asking for the resignation of the superintendent.
We'll follow up on email if you have any other questions. Thank you so much. We'll see you at the takeout.